My body is attacking itself. It sounds extreme, I know, but it's true. My name is Maddie, and I am one of the few adolescents affected by Hashimoto's thyroiditis. So what is Hashimoto's thyroiditis? It is an autoimmune disease of the thyroid gland. The thyroid gland controls hormones in the body, therefore affecting anything from the strength of fingernails to mood. For some reason, my immune system has classified my thyroid as a virus that needs to be destroyed. Antibodies attack my thyroid, making its production slow. This lull in hormone production can make my hair turn brittle, cause me to gain weight, and many other things in between. Hashimoto's is usually found in middle-aged women and is very rare in children, so it took almost 2 years for me to be diagnosed. Those 2 years were terrible. My dad is a medical surgeon, and he still beats himself up to this day about not catching my condition earlier.
Well, in hindsight, I felt as if I should have recognized it earlier. I'm a physician, I'm a head and neck surgeon, and I do deal with some thyroid disease, but I don't deal with it on a real regular basis. But my daughter, Maddie, when she was growing up, she's currently 14, but when she was approximately, 8 or 9, Dana? She was an excellent athlete and also an excellent dancer, and she had huge amounts of energy and liked to be very, very active, and was really happiest when she was active. At some point, I believe when she was about 9, she started having trouble with soccer, especially running, maybe giving out of energy somewhat at dance. She then began to experience some depression symptoms, and then she began to gain some weight, and her body began changing shape. Is, again, in hindsight, it makes a lot of sense now, but at the time, those types of changes, especially in body shape and size, are fairly typical for that age group.
After a lot of badgering from my parents, my pediatrician finally agreed to take a blood test. The results were alarming. My thyroid-stimulating hormone, or also called TSH, level was 21.32. The normal range of TSH is 0.5 to 4.9. My escalated TSH level was indicative of severe hypothyroidism, or underactive thyroid. Probably the most obvious of all of my symptoms was my moon face. Moon face is a frequent symptom in thyroid patients in which his or her face becomes uncharacteristically round. Here is a picture of me in 3rd grade. Notice how there is definition in my face and neck. In this picture from 4th grade, it is obvious that my face has grown very round. This drastic change occurred in the span of only 1 year. This is a picture from when I was in 5th grade. My face was extremely round. I was completely moon-faced. Looking at this progression of photographs, it is easy to tell that something was wrong. Now that my thyroid is under control, it does not affect my life much. I have to take a thyroid hormone replacement called Synthroid every morning, and I will have to for the rest of my life. There is no cure for Hashimoto's, only treatment. I am just so thankful that my parents pressed the doctors to find out what was wrong before my disorder became too serious. Now I live a happy, healthy life despite having Hashimoto's thyroiditis.